So now we are going to enter into the second portion of the workshop. And before our break, we're going to provide just a very brief introduction into each of our breakout sessions, just by our facilitators of each session. Next slide. Before I pass it over to Dr. Moon to discuss the legal and privacy breakout session, I wanted to just briefly introduce her to the group. I hate to read a bio, but she has a wealth of experience. So I just wanted everyone to be aware of what her perspective would be in this breakout group. So Dr. Moon is the CEO of Advocate Consulting LLC, located in Minneapolis. She specializes in regional, national, and international projects using applied informatics and evaluation to design, develop, and deploy interoperable distributed networks in healthcare. Her work has included the initiation of state infrastructures that support HIE and the practice transformation projects that are improving care delivery and consumer experience. Dr. Moon has also worked for the state of Minnesota as the Director of eHealth Privacy Security and Health Information Exchange Oversight. Her team was responsible for coordinating the activities of the Minnesota eHealth Initiative and more than $45 million of grant funds for healthcare reform activities in the Office of Health IT. Prior to all of this, and prior to joining the state government, Dr. Moon worked for a large national payer as a clinical and performance manager, integrating clinical care management programs and innovating population health strategies based on data analytics and predictive modeling. She continues to contribute through state and national working groups on related topics, including blockchain and HIT application startup strategic advisor roles. She's earned a PhD in nursing informatics from the University of Minnesota, and her research interests are focused on implementation science of interoperable distributed health ecosystems and consumer-mediated data management, including information privacy, data security, and consent. Just as a little bit of a side note, Dr. Moon has been helping us with our e-consent product since, I believe, 2017. So she has a lot of background, not only from a national perspective and in her own home state of Minnesota, but also in the Michigan market. So I will pass it over to her just to give a very brief 1 to 2 minute overview of what we're going to be going over in the legal and privacy breakout. And then we'll turn it over to Mike to talk a little bit about the technical one.
Good morning, everyone. It's nice to be here, and I appreciate actually the invitation. And Shreya, thanks for the great introduction. So the legal breakout session today is really going to be discussing the balancing of legal and ethical concerns that accompany e-consent. And I think in today's world, and with the advent, I'm going to say, of digital information in healthcare, as well as a lot of the new policy that's kind of pushing at the edge of with the 21st Century Cures Act, for example, we really do have, I'm going to say, kind of a tight rope act that we're kind of balancing here. So we were thinking that with the legal breakout session that kind of these 5 areas would be of interest to the group. And so Shreya will actually be co-leading with me that facilitation. We'll be talking about HIPAA right of access. And so that's really the right of patients to be able to request copies of their own medical records. There's been actually some really good articles actually out on LinkedIn recently regarding right of access and how right of access helps patients to actually become more motivated, right, within their care. And so hopefully today we'll hit on that a little bit. HIPAA meaningful choice, so giving patients the right to actually, decide, how to control their records, right? What that looks like across the ecosystem, and how does that actually become implemented? So we think about, how does it impact providers, electronic health records, health information exchanges. We'll also look at kind of the whole idea of removing HIPAA protections. And that's really around some of the new FTC information that's coming out. They're taking some old rules that they had and they're kind of dusting them off. Looking at breach notification, for instance, of third third-party apps. And so we'll get a little bit into that. We're also going to be talking about kind of secondary use or the repurposing of health information. And really, what does that look like from a patient or a consumer perspective? And then we're hoping that we can maybe get as far as talking about methods of coordination. And so what does that look like when we enable an e-consent management system to be able to share information across providers, especially in an age of right to access. So looking forward to the conversation, and I'll turn it back over to you, Shreya.
Awesome. Thanks, Lisa. I'm now going to turn it over to Mike just to do a overview of the technical breakout session so attendees can get a glimpse into what's going to be discussed in the other room.
Thanks. One of the worst parts about hosting one of these breakout sessions is not being able to attend the other one. So I'm really looking forward to watching a recording of that session later. In the technical breakout session, we're really going to be taking the legal aspects out of the conversation that they'll be going through in the other breakout session. So we're not going to be talking about when consent is needed or upcoming legislation, but we're looking at the technical pieces. And we're really going to try to have a dialogue going about what consent processes are in place outside of MyHIN's firewall. Are there electronic processes already in use in your world? We're going to try to get feedback about where MyHIN and where Michigan goes from here, where we're at. What does the future look like? What should the future look like? What use cases make the most sense to start integrating with the ECMS? And if no one is participating, then I'm going to just talk about privacy tags. We'll talk about integrating with third-party electronic consent management services, and continue into technical challenges that MyHIN has already faced and we're anticipating coming in the future.
All right, thanks so much, Mike. Now, our break is a little bit shorter. Initially, we are going to have 15 minutes, but we are going to give individuals about 10 minutes to either take a break, go get some water, grab some food, or if you just want to take the time to move over to the breakout sessions, because I believe that's in a different link. We have about 10 minutes for attendees to do so. So we'll reconvene at 11:30 in the breakout sessions, have another brief break, and then lastly, we're going to wrap up the conference with a summary of what things are discussed at each of the breakout sessions. So even though, Mike, you're not able to attend the legal and privacy one, you'll at least get the summary afterwards. I will see you all at 11:30.